A massive contact tracing campaign is underway in the nation's capital, and here's why. This is a photo taken in the Rose Garden about a week ago, September 26th. It was an event for Amy Coney Barrett, the president's SCOTUS nominee, who recovered from COVID herself over the summer. Now you can see the seats are not 6 feet apart, and most people are not wearing masks. The president and Melania were there, and both tested positive. And so far, at least 5 other people there have been tested positive for COVID-19. They include Senator Thom Tillis, Senator Mike Lee, Notre Dame President Reverend John Jenkins, Kellyanne Conway, Chris Christie. And Vice President Mike Pence, he's practically surrounded by people who have since tested positive. To help me break down how far this outbreak could spread, I brought in Dr. Jake Deutsch. He's a New York City emergency medicine doctor who had COVID-19 himself earlier this year and has been treating patients with coronavirus since it reached our shores. Dr. Deutsch, thank you for being with us. The last time we spoke, you were just recovering. You look pretty sickly. You look great today. You've seen how serious this disease can be and how long it can last, even in a young, healthy person like you. What do you think when you see this photo?
I mean, I think everybody was shocked to see that they were implementing the protective equipment that we all expect now. Masks are the standard which we expect to see, and certainly on that level. So, you know, what transpired, people getting sick is really no surprise. Really using masks works. Using testing to try to prevent corona doesn't work. Testing should be used to identify outbreaks, but really the barrier of protection that we need is masks. And when you see on a national level this type of leadership demonstrating that you don't have to wear a mask, it sends the wrong message.
And social distancing as well, because those seats are fairly tightly convened. Now, let me go back to testing. The White House has been using Abbott's ID Now rapid test, which could provide a false sense of security for an event like this and others. Over the past few days, we've seen this, including, for example, the donor event in Bedminster, New Jersey, where we still don't have an idea of whether there was a super spreader event. So, Dr. Deutsch, what are the limitations of that Abbott test? And frankly, of all tests?
Any test could have a false negative. That means that it tests negative and actually there is virus present. So it's the wrong information. So using this Abbott test has some flaws in the fact that it has a higher rate of false negatives. And again, that's the concern that we have, is using testing to prevent is really not the recommendation. Using testing should be able to identify pockets, but the minute you have that test, you could be exposed to somebody and now be passing corona. So the testing alone is not sufficient. We have to have other better barriers for protection.
What you're saying is so vital that I wanted to make this visual, right, to demonstrate exactly what it is you're getting at. And there's a significant time lag between when a person is infected and when they start showing symptoms, right? So that means if someone was exposed last Thursday at the president's event, they could feel fine today, right? But they could still be contagious, right? The virus particles are increasing. They haven't tested positive yet. And so it could be a while before we know the extent of the presidential outbreak. And that's also why testing is a great way of following what's going on and identifying asymptomatic infected people. Could be 40% of us are asymptomatic when we get infected. But it's not prevention. They are different approaches. So let's shift gears and talk about Joe Biden's risk for getting COVID-19. So he debated President Trump last Tuesday. And Dr. Deutsch, Biden and his wife both tested negative on Friday, but you say they are not out of the woods yet. Could you please help us understand why?
Certainly, we see on average an incubation of 5 to 14 days. So until we've hit that threshold, until we've had confirmatory tests, and I would recommend a PCR test, of course, the gold standard, that is not going to clear them from potentially getting sick. So we're going to have to monitor just as closely as anybody else who is in that event. As we saw, there were a number of people who weren't wearing masks in the amphitheater. So everybody's going to be in that same category. We need more time and more testing for them.
I did a little experiment. I analyzed the debate stage setup, and I want everyone to watch this carefully. So insiders tell us the podiums were approximately 8 feet apart from each other on stage. It looks about right? Now, respiratory droplets carrying the virus are produced when we speak, right? And if someone were to cough or sneeze or talk, especially loudly, they typically travel about 6 feet. But there's some studies that are suggesting that small particles containing the virus may be able to diffuse in indoor environments like where the debate was up to 32 feet. Right? And the number of respiratory particles, this droplets produced when someone shouts, and they were definitely shouting at each other, increases, as we saw the candidates, raising their voice quite frequently on Tuesday. Now, this is especially concerning since reportedly the honor system was used to be sure candidates were tested before the debate. They were not tested actually on site, which had been, I believe, the discussed protocols. So there's a lot of concerns that are raised about Vice President Biden's situation. But let me go back to the president. Dr. Deutsch, what are your thoughts about how the president is doing based on the video that he's released over the weekend?
You know, we need to have facts. We need to understand really what the disease has presented with himself. You know, what is his oxygen level? Is he having respiratory complications? You know, there's been some reports of him needing supplemental oxygen. Things could get much worse. And certainly the 7-day window is when we see a very significant turn for some patients. So understanding if you would have that severe cascade of cytokines, which can lead to the inflammatory problems, particularly respiratory failure that may require a ventilator. That's really the critical information. But there's other factors that we see with patients and other symptoms, the fatigue, the severe fatigue. I mean, having had COVID myself, I could barely get out of bed. So that is really in itself one of the most significant findings. But the brain fog, the headaches, the complications with vascular disease, strokes, DVTs, you know, these are all possibilities. And I'm sure his doctors are monitoring closely. And, you know, we hope that none of them become a problem for him. But those are the issues in my mind that we need to be monitoring closely.
So since you've taken care of so many patients on the front lines, give us a rough timeline. If the president is not showing some of the things you're speaking about by, let's say, the middle of this week, is he out of the woods, or do we still have to wait, you know, a 10-day, 14-day, another longer period of time to be sure?
I mean, there's no perfect timeline, but ideally, you know, you have a 14-day window where you're going to say, okay, now we're out of the woods. But at 7 days, I saw a number of patients who took a turn for the worse. So in my mind, that's going to be a very critical point as well. And you know, the other consideration is what his treatment is. I mean, he's getting experimental medications and therapies, including monoclonal antibodies. There's potential complications from that, reactions that he could have. His body could have different manifestations of illness, including kidney injury and other complicated reactions that would cascade from that treatment. So that's what we need to be monitoring. You know, that's the information that we don't have. And of course, it's the president of the United States, so the best level of care is necessary. But it is a bit concerning that he's getting experimental treatment, which may make people think that they should try experimental treatment as well. And we have to be very careful about that.
All right, sanguine advice. So we're going to be holding our breath for 2 weeks. Dr. Deutsch, thank you very much for sharing this very honest information. We're going to continue to monitor this situation as it develops. We'll be right back.